This is my audience. Dr. Death sounds like the name of a supervillain, but it's not. It's the name of Dr. Jack Kevorkian, a doctor and advocate for euthanasia. The dictionary defines euthanasia as the painless killing of a patient suffering from an incurable disease, a painful disease, or an irreversible coma. I believe that it is inhumane to allow a person to suffer and deny them access to a painless death. The practice is illegal in most countries and most of the United States. Dr. Kevorkian advocated for body autonomy and sought to make euthanasia a positive experience. In November 1998, he became the face of euthanasia when he videotaped himself assisting the death of a sufferer of Lou Gehrig's disease. He was convicted of second-degree murder, delivery of a controlled substance, and served 8 years in prison. Many argue that doctors have an oath to heal and treat. However, Eduardo Rodriguez, PhD, argues that if a doctor cannot heal or treat a patient, it is his duty to work in the best interest of the patient, even if this means ending their suffering. According to anonymous polls, 13% to 19% of physicians have assisted in suicides. They are vulnerable to prosecution just like Dr. Kevorkian was. The doctor is not making the choice to end a patient's life, and the choice has already been made. The BBC lists 4 types of euthanasia: active, passive, voluntary, and involuntary. An active act is deliberate and direct, and it is actually an act being performed to end their life. Passive is indirect, such as withdrawing treatment, like taking out a feeding tube, or withholding treatment, like performing a surgery that would prolong life. Voluntary is performed upon a patient's request, and involuntary is performed upon the request of someone speaking for a patient that cannot speak for themselves, like somebody in an irreversible coma. Involuntary euthanasia is something that is illegal and I believe should remain illegal. It's when a patient chooses life and they are killed anyway. And there are actually cases of this happening. My stance is that this is and should always be illegal. I want to make that clear. This is because the choice is not made in the best interest of the patient. However, it's made in the interest of people caring for the patient. A DNR is something that a lot of people have heard of. It's a do not resuscitate order. If a patient's heart stops, a physician does not have to perform any duties or any acts that would help resuscitate them. This is considered common practice and accepted widely almost everywhere. This is because they accept the fact that the person doesn't want to live a compromised life, whether in a vegetative state or if they have suffered some kind of neurological damage. Their decision is respected because of the DNR, and I believe that euthanasia should also be a decision that is respected. I'm going to tell you about a young woman named Brittany Maynard. She's 29, and she was diagnosed with terminal cancer, terminal brain cancer to be specific. She was given less than 6 months to live, and she underwent a lot of different types of treatment, and none of them were working. So she decided that she wanted to have a physician-assisted suicide. She didn't want to go through the pain and suffering. She lived in California where it wasn't legal, so she had to move to Oregon with her husband away from her family to have it performed. She became a well-known advocate because up until this point, most people that you imagine wanting this to happen were older, over the age of 71. So a young, attractive woman was now saying that she would rather die than go through the pain of living with her disease. She passed peacefully, surrounded by her family and friends, on her own terms, at her own times, in her own bed with her husband. Her husband still advocates for physician-assisted death, and here is his response to a judge overruling a California law that allows this to take place.
Brittany Maynard's husband, Dan Diaz. Dan, so good to have you here. So it's a setback, there's no question. And this judge hung it on a technicality that the law was passed while they were in a special session.
Right.
But what do you think is really going on here?
The plaintiffs, in this case, the opponents, they'll do whatever they possibly can to overturn this law. And it's frustrating because 76% of Californians agree with Brittany that a terminally ill individual should have this option at end of life. So the case brought forth by the plaintiffs who are opposed to this legislation, and now this judge's ruling really sets us back 2 years. People who are now in Brittany's predicament, terminally ill with 6 months or less to live, they're now wondering, do they have to do what Brittany did and leave home just so that they can have this option?
How you doing?
I still have, good days and bad days. It's funny seeing that introduction of Brittany. It brings back a lot of emotion. But this is how I honor her and then keep my promise to Brittany, fighting for terminally ill individuals so that nobody else would ever have to leave home after being told that you have 6 months to live.
Right, and those last 6 months matter more than ever, and you have to leave. You have to go to unfamiliar territory.
Right.
The opponents, they have religious objections. They say doctors wield enormous power and potentially could abuse it, that there could lead to elder abuse, all the stuff. You are a Catholic. You get the religious piece of this.
Totally. And all of those, what I call the false narratives, their campaign, the opponents, is based on fear, not the reality of what a terminally ill individual is going through. And yes, as I went to Catholic school. I was an altar boy. The bishop of the Oakland Diocese.
Oh my God. Sorry, 1 second. Technical difficulties.
This is how I honor her and then keep my promise to Brittany, fighting for terminally ill individuals so that nobody else would ever have to leave home after being told that you have 6 months to live.
Right, and those last 6 months matter more than ever, and you have to leave. You have to go to unfamiliar territory.
Right.
The opponents, they have religious objections. They say doctors wield enormous power and potentially could abuse it, that there could lead to elder abuse, all the stuff. You are a Catholic. You get the religious piece of this.
Totally. And all of those, what I call the false narratives, their campaign, the opponents, is based on fear, not the reality of what a terminally ill individual is going through. And yes, I went to Catholic school. I was an altar boy. The bishop of the Oakland Diocese presented me with an award for service in my Catholic community. So I am well aware of the position of the leadership of the church. But interestingly, as far as congregants, the people who go to church, support for medical aid in dying amongst Catholics is 70%. So it's right in line with the general population.
That's the thing that gets lost, is that Brittany had a commitment to live her life well, what was left of her life well.
Right.
The decision about death was made by someone else.
Exactly.
Right? I mean, that's
Yes.
what people miss. This
Right.
isn't the same as you're unhappy and you choose to end your life prematurely.
Exactly. The only choice that Brittany has is Brittany is not choosing between living and dying. That choice to continue to live is no longer on the table for her. The only choice that Brittany, or the only option that she gets to choose between, is 2 different methods of dying. One would be gentle. The other would be struggling and in pain. And that's where Brittany simply said that, she would prefer to be able to look around the room and say, I love you, to the people, to her friends, her family, and then have a gentle dying process. Left to run its course. I mean, she was very...
Okay. To expand on what he was saying, News Hybrid conducted a research study, and after polling, they figured out that 71% of the United States was in support of euthanasia. 19.5 was against, and 9.5 was unsure. What percentage of the United States is religious? That only shows you that, like he said, even though the higher ups in the church might have a certain belief, most of the congregation does believe in euthanasia. And this implies that despite those religious beliefs, most people believe that you have the right to die in the way that you want. Both sides are concerned with the welfare of the patient, yet they cannot agree on the fundamentals of life, and they don't agree on the respect for bodily autonomy. We need to make a change. Everyone has the right to decide for themselves. Physical pain, loss of mobility, helplessness, dependence, incontinence, uncomfortability, loss of dignity. These are all things that lead individuals to make this decision. They should be able to end their suffering when they want. Doctors practice compassion, including non-abandonment of a patient. Abandoning a patient in one of the worst times when they know that they are going to die and they have no control over anything else goes against everything that I believe doctors stand for. One issue with criminalizing the act is that you take away the patient's decision. They can still end their life, but now they're going to have to do it by themselves. They're not going to have help. They're not going to be able to do it in a way that is peaceful, pain-free, and in a way that they have control over anything. They're scared and lonely, and they don't want anyone else to have to get in trouble. So you put all of that on them on top of having to make the decision that they want to end their life. In most jurisdictions, suicide is actually legal now, so why force them to face it alone? I implore you to put yourself in the shoes of Brittany Maynard and her husband. I'm going to show you a little bit more of that video.
He's suffering from pain that not even morphine could alleviate, the inability to sleep for days on end, the nausea, the vomiting, the seizures are what terrified her the most. When those would occur, the small seizures would leave her unable to communicate, to speak, typically for 20 to 30 minutes. When she would have the full grand mal seizures and every muscle in her body is contracting, and she's coming out of those, blood's coming out of her mouth because she's bitten through part of her tongue. That's just the reality of what she's dealing with. And so for her, what comes next as that tumor continues to grow, the likelihood that she would go blind, that she would become paralyzed, that's where Brittany said, I will not die that way. I want to be myself. I want to have a little bit of control of how my final few days on this green earth play out. That's what this program is about.
Millions of Americans want.
Okay. So right now in the United States, and it is euthanasia is legal in Colorado, Hawaii, Maine, New Jersey, Oregon, Vermont, Washington, Montana, California, and the District of Columbia. In California, 507 prescriptions were given out for physician-assisted suicide. Only 374 of those people completed the act. In Colorado, 125 prescriptions were given out, and only 86 people completed the act. So this is a trend in most of the states where it's legal. And what this tells us is that some people made the decision to end their life, and some people changed their mind. The key fact in all of that is they made the decision themselves. I'm not for people killing themselves and losing hope, but I am for them being able to make the decision themselves. Is it the right choice for anyone? No, but everyone should be able to make it themselves. Dr. Kevorkian made an oath to heal and treat his patients, and although a lot of people don't agree, I believe he did that. He made himself a martyr, he served jail time, and he became a villain in the eyes of pretty much everyone in America. Doing what is right is rarely easy, and to quote Dr. Death, when your conscience says law is immoral, don't follow it.